our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have X-ray and laboratory services available to you. Come to us for all your healthcare needs, and you will be happy you did, because we believe that health is wealth. Thank you, and stay blessed.
And therefore, Yema Munyina Ajo by Era One Radio, your authentic online radio station for in-depth knowledge on anything health, any good programs. Hey, that is the platform to be. And then omo easy for muti Munyina happy belated Sabbath free. Yeah, the DMV has say no. And then your health is wealth. Protect it program. So, and just as we do it every day and every Sabbath evening, and so yes, I share at the authentic messages, health messages, Bremo. And then meeting the Dr. Benjamin Opoku Bediako, and then I may more host. I'm standing in for our regular host, Now, send now what you be muti, and so yewo panyi ne nyansa ne nim de wade e be ka ho asem no ekọ anim pagi enti baby a wo bia no me say we stay tuned na we tie ye on health is wealth, protect it jumedie so and then nipa ye ne baba betwetwe nkomo wo ye jumedie no ene ya Dr. Opoku Agyeman osan yosofo enti so what say along the line make as a pastor doctor man nyo wanwa enti your pastor Dr. Opoku Agyeman nene jumadi a ye bebe ka ho asem ya to din chronic and infectious diseases basic understanding yeah kind infections I mean say you more platform so there you know we bring in my friend is infection chronic ones na eba no I what various diseases you know ya brabo mu no Dr. Eba Bemaye some entrasie bi kwan fa so ba ne kofa bae ene kwan e be fa so na ya boy ye ho eba ne yenye ye ho ntiase se ne be ya se nyoma ne bi ba ye kwan ya e betima boy ye ho bae enti ye nche ho no Dr. Opoku Agyeman ye ma akwa aba enwumre e ba dwumadie no so
Dr. Bediako.
okay na na me pesa o ma wa atiefo akwa aba
Atiefo mamu na baby amon se anopa e mamu achi awia so e mamu ha anadwo so e mamu adwo enti afi metie free Dr. Bediako.
Okay. Go Agyeman we de ye mo akwa aba bi em say na odi kan baby obi a obi say anopa awia anadwo ye das pass we appreciate your time say you are taking your time to come to this platform to come listen to us mo fan che say ne ye nyoma ne bi ye ka chiri kakra but yes better late than never until ye mama akwa aba na quick one pastor say ye can say chronic diseases and I say infectious diseases
Okay, member modern afa ni mienu no e de ayem fato ho.
Okay.
Yeka chronic disease by CDC rule no.
Yes.
Yare bi a wakwa me di afi. E boro so no. Na enkoye no. Omo classify and say e chronic. Ana yeka infectious disease yare a etimi efiri nchen ko obi nchen. Say ye wo ana wode ho akofam nipa kro no say aboa bi na abefa firi nchen akoho say ensuo bi na akotom no bi akofa no say bia obi akotie nsuo mu na aye no ana say wahome na obi ahome bi no eno na wonya sa infection no eno na your friend say infection like say obi timi dey free nchen akoma obi na chronic ne dey enya dey a odi betimi free nchen akoma obi da just say oh yeah, the bit is a blood transmission, and I say fluid be transmission be a massive one, and it to me, ultimately, endemic disease, it's a BB, it's a diabetes B, and now say, BB is a cancer B, ultimately, come before.
Okay. I read I mean, necessary say share infectious diseases and was it meaning said there was so many forms of it, and I say there was so many ways that infectious disease a bit me about. Just say you bit me airborne, send a woody can say ubi or yare no na ubi humena also to say COVID yeah kunya and no can remember and say near fam from next day bisu bit me afa insumu te say Kagana and Kekase infamy. So examples nibi. Into ye won sumu, ye wo air, ye wo even touch. Into no net say no net say infectious disease net say and yet just say obi who aka obi hu nkwa net say there are so many mode of transmissions and abroad for cancer ye bekana. And
actually senka wo hwemu infectious disease are causative organisms.
Yes, okay.
Ebini bacteria, ebini viruses, ebini fungi, ebini parasitic parasites no, and prawns no. And you know there was specific cause to be a deba. And then and chronic disease there you didn't changes be.
Okay.
And this are chronic disease no. And a be also ya be also a bit too much.
Check. Okay.
And so a chana so kwa.
And chronic.
Chronic amount.
Okay. In the infectious disease, when you're whether through airborne, whether through say touch, whether through various whatever interaction, human interaction, be a mode, and whether say through bacteria, virus, and also whichever mode of transmission, and also causative organ be meaning it's now move a chat according to the CDC guidelines, more than a year. Next is about chronic. Next is okay. Intimate society for a year corner, I say. Tinton, ye nom sane fa adwen. Enti ye kana kakra na ye nya understanding tinti se ye hu what an infectious disease ye. And ye knew say ade ye friend say chronic no what it is. Okay. Now, look say ye hu what an infectious disease etie. How ye nim say causative next is ade bi na kofa ba na ye say kofa ba e. And ye hu say tena wo mu more than a year and ye say na ye den chronic. With me ama examples of some of this chronic infectious disease and now what my say be the mode of transmission and as the pathogenesis quite fast some of these things in the banner with my just synopsis of AB.
Chronic in ya be a war pathogenic
okay
organism be a transmitted. Chronic
okay
a more of genetic factors be.
Okay.
And I feel so a starrish behavior be.
Okay.
And I say a eating behavior be. And I say a condition be a continue ache na a precipitate be ama hono. And I say a idea be a winye free wa ufu be ho.
Okay.
Enti chronic Arabia and I feel so say wunyini so a wanyini a wokɔ anim no so no. And you may be so to me a pie wa bi die mu a and also ama utimi nya chronic disease. And the chat to no be a when you accident.
Okay.
Na accident na akɔ precipitate ade bi ama. Kopem say e bi a obakɔ akɔhwe ase na ona ba bi na akɔmo akakra na akoye ohaw bi abeto onipadua no mu and so akoye yare bi ama wo a obekon ebi eye I mean classify and cry into say obetime nya bi to say heart disease.
Okay.
Obetime nya bi to say kidney disease. Obetime nya bi to say cirrhosis and say obetime nya bi to say cancer. It's animal women na chronic diseases. Na ewo kwanya ebia fasoba. And it is a usha senior a city no. Senior was sitting a city no. Any baby akokotena no. Any nuani be a woodie. Any idea be a one nom. Nina a play rule ewo sa chronic disease. Now unlike chronic disease no, the infectious disease no dear. Wo any abuana abetena umuno any nipa abuana free mu ebetena umu and as environment na abuana free mu betena umuno one interaction enema ubi fufuro so etanya bi enti eyade a well defined so one call baby ade ni bi wona yare ni bi na obo bibi de say covid hu asem na eno de ye beto wo be chiri.
Okay. Okay, Pastor, let me say, Okasani must say, me on some of them say, you find the chronic disease now. There are risk factors. It be our boy say, it be a lifestyle, it be your eating habit, it be a genetics, it be nipani age, and it be just through nipani through any by not their own cause, by through just some accident, some way of like some bad luck, be they are exposed, and then they get into that kind of like situation. Okay, so what about the infectious diseases? Can you mention some of the risk factors?
Okay, almost so what kind infectious disease that Sunday almost see one almost infection, almost classification by geography, any environmental conditions, any one host baby I work it comes into play. But ya will be a win here at Yarian bit me and answer communicable disease and answer infectious debate me to keep place and see your host.
Okay.
Your agent. And sign a seeing environment now. I don't know. And it baby our the characteristics and the features are and the parasites or transmitters are disease. And we share communicable disease so you were a ways you're from portal of exit, portal of entry. No, you were ways portal of entry fasuba.
Okay.
One is a be over here intermediate host.
Okay.
And also a better be on Finfiwa. Or Bequaco fire arena 3D, Yariano any hormone. Now the abre the arena one is sorry, now the abre the arena any ho. And you will be also a decent unya personal contact. And son, when you're Sayarian. And it will be also a me as my friend say from him. You say airborne from him, one who from him, and our boy go from him. Yarini be was now boom from him.
Okay.
And now, ultimate transmit, be news and about working from him and receive. And intino, you were airborne, vector, and an intermediate host. And there will be this 4 months. Baby, 1 man, no be a cotonado and sapoca, no one who is another cocan. And there were intermediate host no classification can create when you were waterborne and there were water based and there were water washed here. Please single robia and in answer Ubenya portal of entry. Ebeko Numan say Ebeko with the money with Timenia Ayarian. Until you ever found a Marco na Yachim said in a city.
Okay. Anyway, dog, Obama, me per se, me bisa one question. Now, Obama just said all those port of entries in any way, say now my examples on my what about Bechichi, Munkakaka? But I know, say, most of these infectious diseases, sort of like have all these chronic ones, they kind of like have what we call associated behavioral risk factors. Okay. Now, are there ones be about quantum you be able to boy? Send a beer and coffee say because we'll be one idea and so. Send it can I be genetics, be and Mimi says, oh, yeah, you be crowd, but I say, oh, yeah, the woman may meeting Angina, but for some of them, we know say many of them there are some associated behavioral risk factors. Can we mention one of these two, some of them, and some of the pathology, like the various pathways in any ways and all kind of stuff?
Okay, Yamfa chronic disease in chronic disease no there usha and the risk factors in you.
Okay.
But a typical risk factor for chronic disease would be COPD, and I say lungs disease no. It be smoking.
Smoking. Okay.
So, and the diabetes here will life behavior more so they will see the DNA or life so they is here ofa maybe they say obesity obi a also so be what did mu any lifestyle so anya papa no it mean ma wunya obesity what I mean by obesity obi a wa kakraka aburu se ne usi so and wohwe in fact kidney disease and also factors we say the OCD no san no cigarette so a very strong factor no so wohwe adaba as your tia se pan say kidney no any lungs any heart no work together until whichever area ubenya effect bia no enya impact in the other two sides very significant no until no me limit me ho no kaka and una answers did mu no kwan ya fa so we nam bi no special meat bi ne sadia wonya free aduane mu ti say what do you call cholesterol no yeah very important emma the bit is a stroke so besides cigarette no ma benya lungs ho ne ma be ma heart disease betimi amonya stroke no wadidie mu nso betimi amawanya heart disease and so at the same time it may lead to stroke nso it is ohwe nso ya ka diabetes a factor and also generic betimi hereditary through be on at the same time so betimi nya because of what life behavior and
that type 2 no
type 2 type 1 the be and you arthritis bit is arthritis and so na kokwanina and so and it could be inherited and I say any accident can also cause that thing. And you know in short tuberculosis, poor nutrition and a lack of physical activities as well as alcoholic no risk factors are it me chronic diseases.
Okay, the dog necessary say it's any pa to send away church mu kama ya. There's kind of like a triad, like a link between people's behavior. That's the behaviors now, like behavioral risk factors, you know, and then a link between those things, the infections, and then the chronic disease. It's kind of like they are kind of like linked somehow. And I'm a boy.
Okay, Anna, I'm saying you can run, but then answer. Also, infectious disease here are there. It means infective.
Yes.
Chronic disease and yeah, they are infective.
It will be good.
Chronic disease no that characteristics here, what risk factors here can't answer.
Yes.
But infectious disease there must be a parasite, like what I've already mentioned. No, maybe this bacteria, viruses, fungi, and phonics. No, hormona it mean a cause infections. But disease no there other factors there you can want some chronic disease factors you can want everybody idea risk factors there hormone cause. But let's not forget say your case will be a disease that it doesn't mean say a parasite and a parasite disease is a body now because changing the normal way of functioning. And the sniper or yari. No classify either say a chronic cause or a parasitic cause and also a infectious cause.
Okay. All right. So meaning say in either ways in a you can have some sort of interactions between the two. Okay. All right. So that Obinia Claire says sometimes you can have an interactions between the infectious diseases and then the chronic diseases because some friends said Obi enya or chronic disease be that. Now so an infectious thing and let us say when you sutromi no.
I always say SARS here by na here can was COVID minka COVID-19 by say our existing condition be no etimi higher than the only existing condition and it is a what chronic disease is diabetes and as what chronic disease is COPD lung disease now say kunya COVID like I said risk factor 50% and now arise to about 70% into potential time of to live are reduced and then anything medicals or we are very concerned about more pre-existing conditions.
But that's a part because now me per se establish that fact and then I say sometimes having the two of them even increases your risk of death. Send also my percentage and that say so now or chronic disease in be now cover infectious disease have a count to say example your manager say oh no you've increased your chances of dying they say the woman COVID and I think say a tier for 18 per year but I'm
Maneva Bibi Crank has to see. Also, in the CDC statistics currently, almost as in every 10 persons, they actually have at least one chronic disease.
One chronic disease.
Every adult to be when we talk about adult, free 18 we are classified them as adult. And to at least somebody has a condition of chronic one time in his now when you at least one chronic
one of them.
Now one power from 50 going a be all no man counted every 4 years they have about two chronic diseases. So it means either say they have a diabetes or hypertension, or they have diabetes of kidney, or they have diabetes of or they obesity, or alcoholic or diabetes. All those things, along the population
okay. It's a very bad combination. So when you have both the chronic disease and then the infectious disease,
so at least one chronic disease now COVID. Now many pre-existing condition. Now obesity with two chronic disease known as COVID. The tendency is there are two existing chronic disease with COVID
hospitalization
of living is lower than the person only be crying
only be cry. Thank you so much. Dog, I'm say on common the pana your sponsors and me pese ye take a break a kakra bi na ye tie bi kakra free your sponsors na ye ba now about betoa I'm say initially now about be the various types on any way say and na be the questions yi e be ba na enti all the no san chirichiri mu na nka o baba the various links the pathways are some of these things it happens when it comes to the infectious diseases, some of the mode of transmission, some of the way or more behavior, some of these infections is quite more so exercise your way there, and I say changing the normal functions of your body. And now baba be treating into your kwani akokujine yakuti nkrato ye ba nipa ye ne tia Dr. Ernest Opoku Agyeman. And answer Pastor Dr. Ernest Opoku Agyeman and then for chronic and infectious diseases, some basic understanding. Pacho emfriha tie kobebia ye tie nkrato kakra na yasan aba.
Hello, beautiful people of Ghana. This is Vanahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Vanahine Specialist Hospital, our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is wealth. Thank you and stay blessed.
Yamatiefo nyina kwa ba samba era one radio, so your authentic online radio station for anything good music, good health programs, anything that you want is on this platform. make a time to always dial in on Era One Radio. And then you may try your comedy and your health is wealth protect this program. So yeah, Dr. Ernest Opoku Agyeman. So what may say the first part we had a very nice interactive program. Yeah, discussing chronic and infectious disease, some basic understanding. Yeah, they can discuss what chronic disease is here, infectious disease, yeah, how the interactions, yeah, how behavioral risk factors interact between them. Yeah, call akwaji yankrato na Dr. Chirim Kwanya. So wunya already chronic disease, now also infectious disease. How the two of them becomes a bad combination. We use COVID as example. Say, so be what risk factor maybe obi wo pre-existing condition here chronic disease now some of infectious disease to say COVID be count net say oh no chances of hospitalization and so ubenya even death and as we saying high. Doc, I say initially no now we stretch some of the pathways in you know a person who team be nanka o take care no my.
Okay, na ye ka bibi fa chronic ho. Na finally ni ye ka bibi fa ade a chronic no ye ne risk factor kese.
The risk factor, yes.
The risk factor kese. And me pesa me chian kakra bi na me ka ade a ya ye betimi abo ho ba ye be reduce risk factors.
Okay.
You can say wrong eating, bad eating. At this time, we say if you eat well, one of the factors about me are reduce or chronic disease. Now, it also means say if you are physically active. On the other hand, if you do exercise consistently, now you eat well, you do exercise well. When your two factors mean ubetimi they are fighting against chronic disease. The third one is you avoid tobacco in whatever form, and you're smoking in whatever form, and also it reduce the risk of getting certain chronic diseases. And excessive drinking. In what form? It could be. In what form? And also it may reduce chronic diseases. And finally, I say we regularly lifestyle. Or style now will lead it should be more of yourself. So the way when you're imbalance in the in your lifestyle. So when we imbalance your lifestyle, the tendency is you can become one of expose yourself to one of these chronic diseases is very high. Now let's go back to infectious diseases. Already know about infectious diseases were various parasitic organisms or causes infection. Now, and who say there are two ways to get them. Either through penetration or inhaling or swallowing. And it's two ways here, my body no. A beer or parasite beer or only way or fast. And parasites no so omumu ache never say make us a way or fast call you find a bear me and son nine. But air no crown you were droplet and you want nuclei. You can't droplet now. Droplet near dear a bang war. Sir, wabina in Sion Kituana, a free one man, in Sion Kituana, a free mubano. A quad distance be. A duana drop me a sure sass is anity, but sass no, ye young who I have a little bit complex,
and keep on changing.
Epodurans and after infectious, but who see this is a distance of 6 feet.
6 feet.
Meaning says Okasana say baby womb cross 6 feet in a bed drop down.
A bed drop
means a droplet characteristics. It's possible say it be a nuclear characteristics because a drop a bit now call air and not the moment me and confirm I will not bring that one in here now. And it's droplet no big name measles say a droplet. Tuberculosis is a droplet the same walk. Nuclei and so fry a certain distance. Diphtheria, our droplet characteristics. And into no sign, Yadia Mabu within us a bear, Ubea, and Utimi Enya no fast cacra. Yes, I will a bit is a co aura, your friend of fecal aura. So fecal aura, and just a free subby toilet simu na echo one. Ono no no and yaria mu produce intestinal one phrase enteritis and as a gastritis and as colitis.
Colitis.
Omba yemua. Ombetre ono ma wagumu na oma ye sunsun kakaka timi wo fukura ye ekesi na uko shebe uko toilet na emwa no kura ebi efirimu ababonten enti eno another way so an infection it for fecal and oral free toilet mu na ekobet nye toilet na ekoye wonsa na ko touch na wonsa no beka be contaminated na de ka duane na odia na anase enhahamana yekoto ade vegetables na twetwa die no omode nsuo egugu so no se omode egugu so a tomre bi a emo ne bi omo eggs ne bi ho no ma
normally eggs na guso
pepes omo gugu infutuma no mu dise enterobis ono se ni on ne gugu toilet flat toilet ni nsuo asase no mu a etimi che nsuo no fa na bogu advance na afedi and so you can also get that infection. And yewo ebi won mo nso a wo mo nso no omo penetrate omo penetrate na ebi ni histotoma hematobin and nasa histotoma mansoni na omo ngina no they have omo ngina wo class area baby omo wo hematobin is more of tropical area until kolana and as a penimphobia mutran subia and subia contaminated ya ne wo nwa bi me from bulinos so obi ko na okọ jonso o yare ni bi was not jonso gumu o jonso x ni gumu x no hashi no my infected bulinos no bulinos one akọtọ bulinos nu no mo so anyinia no ma hachi no mo wonsu no ti utie mu ano ma penetrating
yeah
omonso akoso sa nti ano more of the Cystosoma family no ena yesa wo oba trypanosomiasis aya friend sleeping sickness no
yeah
eno se wo mo bi am from Chesefry wo so omo ye intermediate host omo so omo kofa obi o yare ni bia na emo na be grow wo mu no mu grow mu a no mo so de akoma anipa foforo at the same time yes I will be a friend no river blindness
river uncle no
also you emo ni bi on ma you tuntum be from sunfry tuntum black on from black fry so black fry no omo so etimi atunsuom omo ya infected na omo ba no mo once no be lay omo eggs no omo ya omo ko no moja omo no no so ekoso sa transmission ni bi so akọ no obi na ode eba ho no da kwa ni mo ayi ni x na okotu ayi okonsuo no ho ba bi omo tunsuo ho no mota wo bebre enti no ukọ anu mo no mo a omo so omo tumi transmitted disease ebi de ma ana omo wo sunfly so leishmaniasis de omo wo forest belt particularly Negev area ho ewo ayi Arabia ho no ba bi ana womo ewo sa desert no so omo transmitted via friend leishmania and so leishmania no omo enum wa ena unya sa yare no it is a hwemu a emwa bia wo de omo ye malaria transmitted malaria de so sa na mosquito ye friend no
Plasmodium Anopheles
Plasmodium ademaya malaria
yeah
and malaria another fly and there's another mosquito so or black and white different Aedes no so also transmitted yellow fever edema enipa from human being and animals and you know yaribia communicable bia no transmittable media bia or transmitted yarende ekoma adefofo. The next one here bacteria one person bacteria so infection na yenye free yenye ho the yanfa the bit is gonorrhea so gonorrhea say obi no obi anko da transmission
ne sanka bi
so and HIV obi no obi
Mhm.
anka goda na fluid in fluid obi anka obi hu so a ono so wonti minya yare ni bi eni nti no eno ye immediate contact and I want mechanical contact no ye aboa no onye na dwene se or transmit yare no de akoma obi fufu but for some reason okotena ade bi so ana ode ba obetena wo so ana or transmit yare no bi
Osaka.
but ono ankasa de o innocent yare no bi eni so ebi ye say ye ordinary fries ye no mutiti ye fie ya omo itimi eye sade
A
no
transmission.
nti ye
Okay.
a lot of yare bebre on ma I could mention thousands and one ye what transmedias omo transmit yare no from human to human and ye what ebi on no so a omo they don't play any role in
Any
it all
rule.
that is mechanically, and transmit disease in the common powerful. Indeed, those are the most important thing. As an adeba ko here kese power USI, there's a comia infections. There's a comia infection, the infections are ukoda uko ebi akọ ba ebi aye medical center bi ni no manoma obi abayara da ho na ebi a oman sterilize ba
Or
bi a
man
obekọ
sterilizer.
na ukodu ho na nso akonya yare na de ko fie. Very important Emma United States government because ebo omo kapa yi. In this area into hospital baby precaution be obs follow no you need to do it because one here bit na fire ready if you want wa would the hospital and wa wo be sra ya akono bit na fire ready dia komo
Okay.
am the
That's a
mechanical
pay. Yes, so, let me say because now the next thing I'm about to be saying, and say with all that has been said, and now you who say you who the difference between the chronic disease, you who the difference between the infectious disease, you who say unlike the infectious disease, chronic disease do not have pathogens. So with the infectious disease, at least there's some pathogens or more carry whether through say intermediate host or through the mechanical means, and then there's always some sort of transmission from one point to the other, either through water, through air, through whatever means, through the airborne, through droplets, anyway. Say now in all of this, we didn't feel like in 2 minutes or 3 minutes and suddenly idea program. So with all this myriad of infections I war anyway say no. So what are some of the common things that you fear? But be a for no one. So you better so boy from some of these common infections. No?
very important say you need a single common thing it me de ebo ni nyina ho ba man ye
Yeah, at least
but
for some of the basic ones.
ebia wo ewe ya be fa ho abitima bo
Mhm.
ebi di say covid ye ba ye bo mass na ye say ye hohoro ye nsa and na ye nyina 6 feet apart for any now stay with somebody for more than 15 minutes. That is one particular way abetimi dey protective won kakra from covid and as won ko join in a larger group womu nyina more max na unka womu na unhealing indiscriminately from people. That is one way I'll be about COVID on. But let me just try to summarize Adebia about how to prevent ourselves from any chronic disease besides certain chronic disease. I cannot mention their name here. But I said, yes, I see who say you're socially and economically sound. In fact, the problem with social and economic issue, it has undermined us in so many things.
Ways.
And particularly, they are undermining where I expose I increase the risks of infection. And no idea to solve a problem, which is more in most cases, it is difficult to solve them because here we're here and who's cancer. And here no I maybe and school no man ko here better so and as a lineage in your family. Oh, individual be on my here they indulge in a certain behavior. So here no uniska and so tinye scaton some oniska so to cigarette no concert Korean those are the things and the tossing say if you keep on adopting a certain behavior like smoking, like alcoholism, like eating indiscriminately, you develop a chronic behavior. And that chronic behavior will lead you to chronic disease. So And that chronic disease will lead you to a certain kind of disability. And then the disability might lead you to death.
Okay.
So that is the chain of chronic diseases.
Yes.
Okay. But when you look at the section of infectious disease, their exposure, it doesn't matter who you are. So and they say who Chroma say it is a British government, the president, Unya COVID.
Yeah.
Unya COVID because he was exposed.
Mm-hmm.
So when you're exposed, that you will not get it. And what is very important, there are certain diseases beyond normal. It is assumed that you cannot get it because you have increased your immunity through vaccinations.
Vaccination, okay.
So, and you wait me to say measles, to say tuberculosis, to say hepatitis, to say tetanus, and then what when vaccines or hormone, which me what it me protect you. And those things now, it me protect on there. And we see time to do it. They say pneumonia, shingles, all of them, they have vaccines for it.
Yes.
So you need to get them. They are all communicable diseases that can kill you. They are all infections that can also kill you. And if there's a solution to it now, I don't see the need. Say, whereby say viral disease no and some virus now it's going to you either get immunity or you die. So you get immunity and stay or you die. And I did a vaccine there. I see no reason why we have to waste time without going for it. And those are the two classifications.
All right, thank you so much, Doug. I'm happy part that we're stressing on the need is if there are some of these chronic infections in any way, say there, now say there's a vaccine, you need to be able to kind of like go take it to protect your own self. Now will be a bisa comment section. No, will be bisa question. Be said. Issue about sterilizing some of these places, like especially the hospital. Like a lot of people go there. By the time they come back, and normal pick up infection from the hospital. Now, Obi Bisa said, how do one make sure, or how do one know the place is sterilized? And the president is also asked and said, does the disinfectant spray really work in some of these situations?
Okay, what I'm trying to say is when you go to any hospital, because the hospital themselves, they are not sure, say every place could be cleaned. I can't use the word sterilized there. They can be cleaned to the fact that you cannot attract or contract any disease from there. No. One thing, wash your hands often. When there's anything like sensitizer, use sensitizer to sensitize yourself before you leave there. Don't go there and be handling all kinds of things.
Contacts.
When you do that now, you contract something by contacting yourself to something that you. The important thing here is that obiawo a kind of resistance. Obiana resistance is very low.
Hello.
The potency no ye high. And you find out you then get sick there. So we get sicker. I resistive no. The treatment so yet then. I heard they say ubetimi akuyare me cost a lot of money. Why you can acquire chronic the other days. And when you go to hospital, don't handle things. When you handle things, make sure you wash your hands.
Wash your hands.
To clean your hands before you leave the hospital, so that you get yourself free. That is what they have to do. Ube free hospital and make sure you desensitize yourself before you leave the hospital or the premises that you're working, so that you don't take anything from there to your home. And I want to make sure that as soon as you reach the home, you don't even go to your living room. You detach all those things and hang them somewhere. Maybe take your shower before you even do anything in the house.
All right. I like say what kind of say people should sanitize themselves and we'll call some of the when they get into contact of some of this and maybe be and say and I would do but you are showing say it is so critical say your level of immunity between two people are not the same. Will be they have higher immunity into adivia be into the baby will be an and then reduce our level of exposure. If there's anything we've learned here, your baby says whatever protocols are available, send a baby home by for some of these chronic and infectious diseases, it beats me about your home by. Dog, yeah, that's a pair. You mean say if you are any last words, my tea for and send a nigga the Juma no akone we emre pay.
Asamoah me pese me can doc me we dey me say yare bi to say heart disease. Yare bi to say malignant neoplasm. Yare bi to say cerebrospinal disease.
Meningitis.
There's yare bi to say chronic obstruction pulmonary disease.
COPD.
Accidents, diabetes, Alzheimer's, influenza, kidney disease, septicemia, and what not. Ne nyinaa yɛ yare bi a ɛtumi yɛ chronic anaa bi nso yɛ chronic ɛwɔ yɛn so. Na ne chronic na ɛyɛ yɛ no ɛnyɛ da kopɛ ne baeɛ. It started with the behavior. Enti saa behavior na yɛn mpanimfoɔ yɛnya no yɛ na ɛden sɛ nkwalaa no bɛhu na ɔmaka sɛ ɛmi papa wei na onyaa yɛ nti adeɛ oni nyɛ bi. Enti nka bɛyɛ a wofɔ no yare bi a ɛwɔ so a onim sɛ ɛyɛ chronic no bɔ mmɔden akyerɛkyerɛ wo ba mu na wantumi ankɔyɛ the same behavior no ankonya saa yare no daakye, because it is known say socially and also economically no adeɛ bi a wobɛyɛ bia no nya impact wɔ life so. It is known say adeɛ bi a woyɛ kyɛ bia na ɛbɛyɛ wo behavior. It is also known say adeɛ bi bɛyɛ wo behavior betumi bɛyɛ chronic disability bi ɛbɛtɔ so. So anything no chronic disability ɛbɛtɔ na mo anya yare o. And you are going to fight for it. But when you say a kwan bi wa betumi abɔ ho ban from the base level no, ɛdeɛ na si ho kwan sɛ umo saa adeɛ no ho ban. Ɛna mama me emphasize kwa ɛnyɛ ohia nko na me yɛ yare. Ɛyɛ ohia ɛba wo so a aduane kakra obedi ama ho atɔ wo no onya hoden no. Fa sika nyinaa to saa aduane di. Na nya hoden sin sɛ odi a odi sika no besi. Atwɛn bibi foforo na akɔfa yare no abeto ho no afi unye sika mfenko na ɛde wo ha wabrɛwo. Ɛna mamu ye emfisu sɛ yare bi to say diabetes ma mo sickle cell din because na hu hu asem ebodin wo hase. Ɛne ada yare tarasimus ɛno so ma modin ɛno so enya de bi asem bodin wo hase. Fi sɛ ɛno de yɛ mogya mo yare a from parents to children. Yes. Yare bi a untimi infect ma chronic already chronic for you.
Chronic that right from birth.
You better work through a couple time and it's in a man can and who has some. Now, my body in the way I bet my preventing and my can was some. And I'm infectious disease so uko baby a year hospital show ye. Baby a year resident and nipaguo show ye. And yare bia so a insect net transmitting community no come but modiana mo bi nkan jero common disease because nipa mienu bi wo yare ba ko bi te community mu a hu say ebetima kɔ nipa be nso ana nwotwe ana eduo mu nipa dunya ebetima ya epidemic ho no yade a significant power yare a insect net transmitting tina malaria ay endemic Ghana no endemic because community no yare no wom nti obi obekɔ obi as no anya bi tunya bia na amana ye endemic. Nti asam kakra metima kafa on so yemo ye ho ban against the hospital name cause na nosocomial infection yentime anya bi and after so you need living a good behavior so that they are chronic diseases we can also prevent ourselves from it.
Look, that's a pair years and then was spare some valuable time na only a tier for ache edition say and they would tier idea for chronic and infectious diseases say be some basic understanding of it. Dr. Ernest Opoku Agyeman, Pastor Dr. Ernest Opoku Agyeman and then no echiche nkomo no for yedamasi pay around radio soon and health is wealth protected jumedi and then we kasai. Yes, so make a date with us next week the same time 6 to 7 p.m. sharp. We will be here. We have so many good things for us to be. Most time, this is what I tell people. I'm kind of saying, "Ubetimi our fee, ubetimi our house, ubetimi our car, ubetimi our any other thing." But one of the most important things you can ever have in your life is your health. because health in the was any we can and say who is that's all that's all the ball it's so important you use it to take care of yourself because health na it say car with the quadruma say do say service na one service here that could highways one eja honum so also why you busy honum busy ni nyina betie everywhere so you might have to find a way out. And that is how our health is. One taking care of our health, it is the engine through which you run. So health in the way can FSM crowd won't mean young within them. So health in the way we feel FSM crowd won't mean number was so many enjoy. So health is wealth. Protect it. When you come share baby, I would say be an next week. Make a date with us. Around radio. Health is well protected. You be share. When you come dog. When you share baby, next week.
Okay.
Hello, beautiful people of Ghana. This is Banahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Banahine Specialist Hospital, our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is wealth. Thank you.